basically a thin fold of mucous membrane with enclosed muscle fibers that attaches the lips and the cheek to the alveolar mucosa, the gingiva, and the underlying periosteum. Frenectomy means removal of the frenum. But if it's a natural structure, why does it require removal? The frenum is considered as pathogenic and requires removal when abnormal frenal attachment is present, which causes a midline diastema, when the frenum is too close to the gingival margin, and when it causes gingival recession. When there is no apparent zone of attached gingiva along the midline, this means the frenum has made the vestibule too shallow. This can complicate the construction of a denture. In this case, the frenum needs to be removed. Blanch test is the most commonly used method for the diagnosis of a high frenum attachment. In this test, the frenum is pulled and we have to see if there is any movement of the papillary tip or if any blanching is produced. This indicates that the frenum is attached on a high level. The abnormal frenal attachments can be treated by frenectomy or frenotomy. There is difference between these two terms. Frenectomy means complete removal of the frenum, including its attachment to the underlying bone, and frenotomy is the incision and relocation of the frenal attachment. Surgical techniques for frenectomy are the simple excision technique, Z-plasty technique. These two are effective when the mucosal and fibrous tissue band is narrow. When the frenal attachment has a wide base, localized vestibuloplasty with secondary epithelialization is preferred. Fourth technique is laser-assisted frenectomy.